Feeding your baby is a special time for bonding. It's a moment where you can connect deeply with your little one, creating a sense of security and love that will last a lifetime. Providing essential nutrients for healthy growth is crucial during these early stages. Whether you choose to breastfeed or bottle feed, the goal is to ensure your baby receives the nourishment they need to thrive. It's a learned skill for both you and your baby, and with a little patience and practice, you'll both become pros in no time. Remember, every feeding session is an opportunity to learn and grow together. Whether you choose breastfeeding or bottle feeding, this guide will provide valuable tips and insights to ensure your baby is well-nourished and thriving. We'll cover everything from the basics of latching to the best bottle feeding techniques. Remember that every baby is unique and will develop at their own pace. Some babies may take to feeding quickly, while others may need a bit more time and encouragement. Don't be discouraged if things don't go perfectly smoothly at first. It's normal to face challenges, and it's important to stay patient and persistent. Your baby will sense your calm and confidence. Trust your instincts and seek guidance from your pediatrician if you have any concerns. They can provide personalized advice and support tailored to your baby's needs. In the following sections, we'll delve into the specifics of mastering baby suckling, understanding their feeding cues, and recognizing when they're full or still hungry. These cues are essential for ensuring your baby gets the right amount of food. We'll also explore the world of diapers, weight gain, and potential food sensitivities. Knowing what to expect and how to handle these aspects will make the feeding journey smoother for both you and your baby. With the right knowledge and support, you'll confidently nourish your little one and embark on this incredible journey of parenthood. Embrace each moment and remember that you're not alone. There's a community of parents and professionals ready to support you every step of the way. A good latch is crucial for efficient feeding, whether your baby is breastfeeding or bottle feeding. For breastfeeding mothers, a proper latch ensures the baby is getting enough milk and prevents nipple soreness. This involves the baby taking a large portion of the areola into their mouth, not just the nipple. When the baby latches correctly, you should notice their lips flanged outwards, covering a significant part of the areola. This helps create a vacuum seal, making it easier for the baby to draw milk efficiently. You might also hear a rhythmic sucking and swallowing pattern, indicating that the baby is feeding well. If the latch is shallow, the baby might only suck on the nipple, which can lead to discomfort and insufficient milk intake. To achieve a deeper latch, try different breastfeeding positions, such as the cradle hold, football hold, or side-lying position. Each position can offer a unique angle that might help your baby latch more effectively. For bottle-fed babies, ensure the nipple is full of milk before offering it to prevent them from sucking in air. Air bubbles can cause gas and discomfort, making feeding time less enjoyable for your baby. Tilt the bottle to a 45-degree angle, allowing the milk to flow at a controlled pace. This angle helps mimic the natural flow of breastfeeding and can reduce the risk of overfeeding or choking. If you're experiencing latch difficulties or have concerns about your baby's suckling, don't hesitate to seek help from a lactation consultant or your pediatrician. They can provide personalized guidance and support to ensure a positive feeding experience for both you and your baby. These professionals can offer tips on positioning, latch techniques, and even recommend tools like nipple shields or specialized bottles. Remember, every baby is different, and what works for one might not work for another. Patience and persistence are key. With the right support and information, you can make feeding a rewarding experience for both you and your little one. Babies communicate their needs through various cues, and it's essential to recognize their hunger and fullness signals. Early signs of hunger include rooting, turning their head towards your touch, sucking on their hands, and becoming more alert and active. As they become hungrier, their cues may become more intense, such as crying or fussing. When full, babies will typically slow down their sucking, turn away from the breast or bottle, and appear content and relaxed. Pay close attention to your baby's individual cues and avoid forcing them to finish a bottle if they seem full. Overfeeding can lead to discomfort and digestive issues. Babies often swallow air during feeding, which can lead to gas and discomfort. Burping helps release trapped air, making them more comfortable and less fussy. Hold your baby in an upright position, either over your shoulder or sitting on your lap with their chin supported. Gently pat or rub their back to encourage the release of air. You might hear a burp or feel a release of air from their tummy. Not all babies burp after every feeding, but it's good practice to offer a burping break during and after each feeding session. If your baby seems uncomfortable or gassy, try different burping positions to find what works best for them. Section 5. Diaper Decoding. What's normal and what's not. Diapers offer valuable insights into your baby's hydration and overall health. By paying close attention to the contents of your baby's diaper, you can monitor their well-being and catch any potential issues early. In the first few days, newborns have a few wet and dirty diapers as their bodies eliminate meconium, the first stool. This thick, tar-like substance is a sign that your baby's digestive system is starting to function. As they start consuming more milk, whether through breastfeeding or formula, the number of wet and dirty diapers increases. This is a good indicator that your baby is getting enough to eat. Expect around 6 to 8 wet diapers per day, which shows that your baby is well hydrated, and at least 3 to 4 bowel movements per day. The frequency of bowel movements can vary, but this range is typical for most infants. The color and consistency of their stool will change depending on their age and diet. For instance, breastfed babies often have yellow, seedy stools, while formula-fed babies may have firmer, tan-colored stools, and whether they are breastfed or formula-fed. These differences are normal and expected, so don't be alarmed if your baby's stool looks different from another baby's. If you notice any significant changes in your baby's diaper output, such as a sudden decrease in wet diapers, it could be a sign of dehydration or other health issues. Or blood in their stool, consult your pediatrician promptly. Early intervention can help address any concerns and ensure your baby stays healthy and happy. Section 6. Weight Watch. Monitoring your baby's growth. Regular weight checks are crucial for monitoring your baby's growth and ensuring they are thriving. During the first few days after birth, it's normal for babies to lose a small percentage of their birth weight. However, they should regain this weight within 2 weeks and continue gaining weight steadily. Your pediatrician will track your baby's weight, length, and head circumference during well-child visits to ensure they are growing at a healthy pace. If you have any concerns about your baby's growth, don't hesitate to discuss them with your pediatrician. They can address your concerns and provide personalized guidance. Section 7. Food sensitivities. Recognizing the signs. While rare, some babies may have food sensitivities or allergies. Common culprits include cow's milk protein, soy, eggs, and wheat. Signs of food sensitivities can vary but may include excessive gas, fussiness, eczema, vomiting, diarrhea, or blood in the stool. If you suspect your baby has a food sensitivity, keep a food diary to track their intake and any reactions. Consult your pediatrician, who may recommend an elimination diet or allergy testing to identify the trigger foods. Remember, breastfeeding mothers may also need to adjust their diet if their baby has a food sensitivity. Your pediatrician can provide guidance on appropriate dietary changes. Section 8. Seeking support. When to consult your pediatrician. Navigating the world of infant feeding and care can be overwhelming at times. Remember that you are not alone, and there are numerous resources available to support you. Your pediatrician is your go-to resource for any concerns or questions you may have. Don't hesitate to reach out if your baby has trouble latching, experiences feeding difficulties, shows signs of food sensitivities, or exhibits any concerning symptoms. Your pediatrician can provide personalized guidance, reassurance, and appropriate interventions if needed. Remember, you are doing a great job. Trust your instincts, seek support when needed, and cherish these precious moments with your little one. Section 9. Conclusion. Enjoy the journey of parenthood. Mastering baby suckling and navigating the world of infant feeding is a journey of learning and growth for both you and your baby. By understanding the basics of latch, recognizing your baby's cues, and seeking support when needed, you can ensure your little one thrives. Embrace the challenges and celebrate the milestones as you embark on this incredible journey of parenthood. Trust your instincts, cherish these moments, and remember that every baby is unique and will develop at their own pace. With a little patience, love, and the right support, you'll confidently nourish your baby and create a strong and loving bond that will last a lifetime.